Well, we all have mental health, and it's on a spectrum. So some days we are not feeling well and we're feeling low and depressed, and other days we're feeling great. So everyone in society has mental health, and it's similar to physical health, where if you're struggling and you need help, talk to somebody. It's just like if you have a broken arm, you're going to go to the doctor. If you're struggling and not feeling well with your mental health, reach out and talk to somebody, whether it's a friend, a doctor, a colleague, anybody. Just let somebody know, because you need to speak about it in order to get help and get connected with resources. Folks are feeling really lonely and isolated right now, especially seniors in our community. So we have some fantastic resources at CMHA. There is a program called Thrive Learning Center. It's free to the public. It's free to anyone. You don't have to have a mental illness. And it's on Zoom every Tuesday at 2:30. We cover topics such as how to improve your sleep, how to improve your mood immediately, exercise, how important exercise is for folks. And it's completely free. And I would also suggest there's a program called Bounce Back, and that is also free through CMHA, and you can check it out at bouncebackbc.ca. You can be connected to a person on the other end of the telephone or through Zoom, and it can be around your schedule. So it's very flexible timing. And those programs are all free through Canadian Mental Health Association. Another program that we have is we have a mental health advocate on staff, and that is a program for anyone that might be struggling with their mental health, and they can give them a call, 778-476-5411. And somebody will phone you back. But if you need somebody to advocate for you, whether it be applying for disability, or you just need you have a tenant dispute, something like that, our mental health advocate is there to help anyone. You don't have to have a diagnosed mental illness, but it's there free of charge. We have a full meals program at Canadian Mental Health Association 7 days a week, and we've seen folks that have been struggling with nutrition and eating, and so they've joined in with the meals program, and it has improved their mental health. So people need a house, they need nutrition in order to get better. So once they have those two things secured, then they can work on their recovery with their mental health. In one of our courses called Living Life to the Full, we teach people how to break down your problems. So if you're just feeling low and you don't want to get out of the house, the course teaches you how to take it step by step. So maybe the first day you just put your shoes on and walk to the mailbox, and then the next day you go a little bit further and a little bit further, and then you're outside. You're breaking down the problem into small, manageable pieces, and that gives folks hope, and it gives them a plan and how to start getting out of the house and starting to feel better. So that's one of the things that we teach. We also really talk about nutrition a lot at CMHA, and the importance of having a really colorful plate. So having some green leafy vegetables and maybe some, proteins, and just having a well-balanced diet can really improve your mood. And exercise is just so good for people. Even a walk for 5 minutes, it changes your whole chemistry in your body. It makes you feel a lot better. So that's one way to overcome feeling a little bit low. You can do it from your own home. Maybe call a friend that you haven't talked to in 10 or 15 years. Start back with a hobby that you really enjoyed. So maybe you love singing. Start singing in the shower. Maybe you love reading. Go to the library, grab some new books. Think of a hobby that you enjoyed in the past and try to incorporate that into your life. Try to connect with others as much as you can, even though we can't come together in person. Maybe phoning people, meeting outside. The weather's getting better, so if you can meet at a park or just go for a walk on the KVR trail. There's so many places that we can go outside right now, and it's safe. So that I would suggest those things for sure. We do have volunteers that come into CMHA, and they mostly work in the kitchen. When we're back open, we encourage volunteers. We've had people running like a woodworking group, a walking group. We did Tai Chi, different programs like that. So if anybody has some skills, such as teaching skills, we even had a drama therapy group, which was a really big hit. I would encourage anybody that would like to volunteer to talk to us. So when you see a client come through the doors and they're really struggling, they may be feeling depressed or anxious, and then they connect with services, and it maybe not just with CMHA, but we refer to other agencies, and you see them in their recovery, and they start to open up and they start to talk to people when they feel more comfortable, and you can see a real improvement in their mood. It's really, really nice to see, because we all have mental health, and we all struggle from time to time. And again, I would encourage you to reach out. The crisis line is available 24/7. And if you're, even if you're just feeling a little down, there's somebody on the other end of the phone that will listen to you. So it's a free service, and if the lines are busy, they will connect you to another crisis center in the province. They all work as one. So like I say, if you're struggling, reach out and talk to somebody. So our website is sos.cmha.bc.ca, and there's lots of great tips on how to improve your mental health on that website.